Welcome to another easy nursing review. In this lesson, we will cover hyperparathyroidism. Before we begin, which laboratory data would make the nurse suspect that the client with primary hyperparathyroidism is experiencing a complication? 1. A serum creatinine level of 2.8. 2. A calcium level of 9.2. 3. A serum triglyceride level of 130. 4. A sodium level of 135. Learn the answer at the end of this video. Now, let's begin by first learning what hyperparathyroidism is. Hyperparathyroidism is a disorder of calcium metabolism due to overproduction of parathyroid hormone. Overactivity of the parathyroid glands caused by a tumor produces too much PTH, resulting in hypercalcemia and hypophosphatemia. Excess calcium is reabsorbed by the kidneys and may result in kidney stones. However, malfunction in the feedback mechanism prevents detection of excessive calcium levels in the blood, thereby failing to adjust the secretion of PTH. Parathyroid tumors are usually benign. Note that this is found most often in clients over age 50. Now let's go over the signs and symptoms of the patient. Here are the following signs of symptoms. Asymptomatic. Increased serum calcium level. Bone pain or fracture as a result of excreting calcium from bone. Kidney stones. Frequent urination as a result of increased calcium in the urine. Now let's go over important labs and diagnostics. Increased serum calcium, increased serum PTH, decreased serum phosphate, increased urine calcium, presence of parathyroid tumor shows on ultrasound, fine needle biopsy of the parathyroid tumor. Okay, let's move on and learn about treatments for hyperparathyroidism, surgical removal of the parathyroid tumor. Knowing that, here are the medications used for a patient with hyperparathyroidism. Bisphosphonates to lower serum calcium by increasing calcium absorption in the bone. Diuretics such as furosemide to excrete excess calcium in the urine. Alright, now let's move on to nursing actions. The nursing actions include the following: monitor intake and output, monitor for fluid overload, monitor electrolyte balance, administer IV normal saline to dilute serum calcium, force fluids, give the patient acid ash juices such as cranberry juice, strain urine for kidney stones. And with nursing action comes patient education. Teach the patient to avoid over-the-counter calcium supplements, maintain daily activities. Alright, well, you made it to the end of the video. Back to that question at the very beginning of the video, which laboratory data would make the nurse suspect that the client with primary hyperparathyroidism is experiencing a complication? 1. A serum creatinine level of 2.8. 2. A calcium level of 9.2. 3. A serum triglyceride level of 130. 4. A sodium level of 135. Correct answer is 1. A serum creatinine level of 2.8. A serum creatinine level of 2.8 would indicate the client is in renal failure, which is a complication of hyperparathyroidism. The formation of stones in the kidneys related to the increased urinary excretion of calcium and phosphorus occurs in about 55% of clients with primary hyperparathyroidism and can lead to renal failure. Well, that ends this lesson. Check out this nursing video here to learn more.